First, we had to go from strangers to friends.
As soon as we learned about solitary confinement, we knew we needed to do something.
The work that we did for the project started with meeting all together.
Came up with this idea to have a panel.
We designed flyers with facts and figures, information about solitary, and distributed them around campus. People of color and members of the LGBTQ community are disproportionately thrown in solitary.
They're very marginalized to begin with.
24% of prison suicides occur in solitary.
Kids being locked up.
People who've spent time in solitary are more likely to self-harm.
It's a horrible act, and it's occurring in our country, and it absolutely needs to be addressed.
We teamed up with the New York Campaign for Alternatives to Isolated Confinement, also known as Caic, and came up with an action plan. We learned about the Halt Solitary Confinement Act. On 3 separate occasions, we gathered signatures from students across campus.
We were making something happen.
By the end of the semester, we had gathered about 300 signatures.
Hopefully with these signatures, we can get that act passed.
We met with Claire to learn more about the specifics of the HALT Act.
If somebody is so violent or aggressive that he needs to be separated or she needs to be separated, the first phase is for 24 hours. After that, if the person is still too progressive to go back to general population, it can be lengthened to 3 days. And then it can also be extended to 15 days.
Claire held it together.
There's a lot of support for each other.
So they'll still be separated from
General population.
but they'll be getting mental health
That's
treatment.
right.
We learned that in New York State, an individual can spend an indefinite amount of time in solitary, while the UN, in accordance with their Mandela rules, says that anything over 15 days is considered torture. As a group, we decided to host a panel discussion and brief film screening. We wanted to emphasize the alternatives.
We really tried to emphasize the idea that this is a form of torture.
We also learned that Caic had been attempting to meet with Senator John J. Flanagan of the 2nd Senate District on Long Island. They had been planning several meetings to meet with him, and we decided to get involved. A town hall meeting between several local organizations was scheduled to meet with Senator Flanagan.
I would have loved to be able to speak to Senator Flanagan.
But he never showed up.
Unfortunately, he wasn't there.
We realized that we would need to fight harder for our cause.
People in solitary confinement need a voice.
Really has no positive effects on a person or society.
Who's going to speak for people that are in there? And the answer is social workers.
Speak up.
As representatives for Caic, we were forced to bring our protest to Senator Flanagan's office.
Being in a group of people definitely makes it easier.
A representative from Newsday and News 12 were also in attendance.
Going to Senator Flanagan's office and, addressing him even though he wasn't there.
But again, he was not there.
You want to talk to Senator Flanagan and urge him to support the HALT Solitary Confinement Act. Currently, in New York State, there are over 4,000 individuals, men, women, and children, who are kept in solitary confinement indefinitely, while the UN says that anything over 15 days is considered torture. What we're asking for is the passage of this bill, which basically limits how much time people can spend in solitary confinement, provides oversight to determine who's going in, why they're going in, for how long, things like that, and providing more funding for alternative programs that ensure that people are getting the psychological and the physical help that they need so that they don't have to go into solitary.
When do we want it? Now!
We took our rally outside of his office, to let the community know what we were all about.
Think outside the box.
The average size of a solitary cell, 6 feet by 9 feet, or a little bit larger than a king-sized mattress.
Really tried to change the way people looked at solitary confinement.
Relevant to really everybody in society. You can't save the world in one day with one panel for one project.
If you see something wrong with the world, you have the power to change it.
Great things happen when people with similar minds and hearts and ideas get together.
You can make a change.
William Blake, who's been in solitary and imprisoned in New York State since 1988, said, "Dying couldn't take but a short time if you or the state were to kill me. In SHU, I have died 1,000 internal deaths."
Most Americans really just want to do the right thing. And this is the right thing to do, is to reduce the number of men and women to zero that are being punished with solitary confinement.
I did 2 years in solitary confinement, 2 years straight. And as it indicated that any time that we move, we shackled and chained.
To this day, my son's sentence, which would have been 1 to 3, has reached into 18 years, going on 19 this summer. Because a person with mental illness in the prison system does not make parole. They can keep them indefinitely, especially when they take the insomnia plea.
About 3 years ago, we made an affirmative decision that we needed to adopt the human rights framework as part of our health mission.
For me, this is, if nothing else, it's a moral issue. We are treating people in an inhumane, torturous way.